Hello, so for our healthcare project, we are going to discuss promoting a healthy work environment, and we're going to go over what that is, how it can be done, and why it's so important.
Hi, my name is Hope, and I will be discussing the description of the topic, which is promoting a healthy work environment. So, according to the American Nurses Association, a truly healthy work environment fosters overall well being, physically, mentally, and socially. It is not only about preventing harm, but also creating conditions where people feel supported, valued, and able to thrive. This environment promotes safety while encouraging optimal health for everyone in the workforce. And there are six components that promote a healthy work environment. The first one is skilled communication. We want to be able to communicate with our leaders, such as our supervisors, managers, and charge nurse, and other staff that we work with. Two, we want to be able to have true collaboration. So we want to be able to work as a team with others, and we want to make sure we choose the best possible choices for our patients. And if we need help, we are able to reach out. The third is effective decision making. We want to make appropriate decisions for ourselves, staff, and patients. The fourth is appropriate staffing, which means we want to make sure the patient to staff ratio is appropriate and healthy for us. And if it is not, we are able to speak up for ourselves. The fifth is meaningful recognition, which means we are recognized for doing well and recognize others for doing well too. And the sixth is authentic leadership. And we want to make sure we have leaders that inspire us to do well and promote us in the workplace.
I'm going to be going over how promoting a healthy work environment can be applied to leadership and management. So, the first way I'm going to go over is the use of effective communication styles. So, effective communication in healthcare means more than just exchanging information. It requires clarity, openness, consistency, and active listening. Leaders set the tone for how reports, feedback, and concerns are handled. Clear communication reduces errors and stress, especially when using structured tools like an SBAR. It also builds trust and psychological safety because it encourages staff to speak up without fear. Teams with transparent and respectful dialogue experience fewer conflicts, stronger collaboration, and higher morale. Consistent communication strengthens leader credibility, while awareness of diverse communication styles supports cultural inclusivity and patient safety. And then the second way we can apply this to leadership and management is through role modeling and ethical leadership. So, role modeling is how leaders' actions define expected behavior. Ethical leadership involves fair and values based decisions that prioritize safety, integrity, and staff well being. Nurses look to leaders for cues on professionalism, and when leaders act with respect and accountability, they set the cultural standard. Ethical leaders prevent toxic environments by addressing bullying and favoritism, and they support moral integrity during ethical challenges, and they also reinforce fairness in practice. Acting consistently and ethically builds trust, reduces turnover, and cultivates a supportive workplace culture that enhances performance. So, in short, communication builds clarity and collaboration, while ethical leadership sets cultural and moral standards. And together, they foster trust, safety, and stability, which leads to better nurse well being and better patient outcomes.
Hey guys, this is Josh. And so, for application in leadership and management in promoting a healthy work environment, um, we can look at time management principles and also incorporating emotional intelligence. So, for time management principles, we can ask ourselves what must be done immediately. We can also ask ourselves what must be done in a specific time frame. Also, considering end of shift tasks. Also, delegation. What can our nurses delegate? Are they delegating correctly? We can assess that. Also, proper use of time management leads to greater productivity, decreases work stress, ensures quality patient care, and brings about satisfaction with the care provided. Also, time wasters include starting a task while not completing another, documenting at the end of shift, and making repeated trips to the supply room, which all slow nurses down in their patient care. Now, time savers include documenting nursing care as soon as an intervention or assessment is done, doing more difficult or strenuous tasks when energy levels are high, and lastly, avoiding interruptions and graciously declining unreasonable and poorly timed patient requests, which could arise quite often in the clinical setting. Now, so for emotional intelligence, we covered that a lot primarily in module one. And it's basically the ability to self regulate, use empathy, proper social skills, and just to be able to understand people's emotions and where they're coming from. Now, this can be very hard. I know a lot of us have been stressed to the max in nursing school, and we've seen some of our nurses in the clinical setting get really frustrated emotionally with patients, providers, or their colleagues. But we need to do a good job now of practicing this as nursing students, so that when we potentially become leader managers, and even just nurses in general, we're going to be leaders. So we need to really just practice and hone in on who we are in the present, how we're feeling, and just realize that we must think before we speak. We don't want to throw words that hurt people, and we definitely want to be sociable and approachable. So, as far as time management and intelligence goes, this can greatly impact the climate of the nursing unit in a way that promotes a healthy work environment.
Hello, my name is LaShawn. Today I'll be sharing how the Caritas process, number 4, cultivating trusting, caring relationships, can transform not just patient care, but the entire work environment. This process is rooted in Watson's caring science, and it aligns beautifully with what we know about psychological safety, team cohesion, and retention. Let's explore how we can bring this to life in our clinical settings. Caritas process, number 4, invites us to go beyond task based care and embrace authentic human connection. It's about deep listening, empathetic engagement, being truly present. This theory is a call to action. When we show up with compassion and curiosity, we build trust, and that supports both healing and teamwork. Here's where theory meets reality. When we cultivate caring relationships, we foster psychological safety. Staff feels heard and valued. We also bridge divides between day and night shift, which encouraging mutual respect and shared problem solving. When trust grows, so does retention. There aren't just soft skills, they are strategic tools for a thriving workplace. Now, let's talk about implementation. First, leader rounding becomes more than a checklist. It's a moment to ask what matters most today and truly listen. Second, peer monitoring circles helps build bonds across experience levels, using appreciative inquiry and highlight strengths. And third, caring communication boards gives staff a voice, whether it's gratitude, concerns, or ideas. These practices reinforce transparency and shared ownership. When we integrate these practices, the data speaks for itself. Staff engagement can increase by 10% within just 3 months. Turnovers drop, psychological safety improves measurably. These outcomes aren't just numbers, they reflect a culture where people feel seen, supported, and empowered.
The second Watson Caritas process that we'll be discussing is co create. So, co create refers to creating a healing environment at all levels. It's a subtle environment for energetic, authentic, caring presence. So, when referring to the workplace, the co create Caritas process emphasizes creating the best possible environment for staff to work and practice in. So, this Caritas process directly aligns with promoting a healthy work environment because it focuses on creating a positive and healing environment for both patients and staff. So, it can be utilized in practice in the following three components of a healthy work environment, which are collaboration, skilled communication, and authentic leadership. Starting with collaboration, so the co-create Caritas process encourages the social environment of a workplace to be supportive, and this can be achieved through true collaboration. So, in practice, this can be seen by nurses and staff collaborating with one another on practices to best support one another on the unit when providing patient care, and this helps to promote a healthy work environment. The second component, skilled communication. So, for the co create Caritas process to take an effect to create that healing environment and the best possible environment for staff, such as nurses, to work in, communication is key and it has to be effective amongst all staff. So, this can be seen in practice by leadership, management, or administration having an open dialogue with their staff, actively listening to their concerns, and everyone in the workplace honoring each other's perspectives. And this will help to, again, promote that healthy work environment. And for our third component, authentic leadership. So, authentic leadership is required to emphasize and implement that co create process in a healthy working environment because the leadership, admin, or management is responsible for creating the best working environment for their staff. In practice, this can be done by providing the necessary supplies, equipment for patient care, and implementing changes to best support their staff. And therefore, once again, promoting that healthy work environment by supporting their staff, by providing that authentic leadership, and creating that healthy work environment. So, as we can see, the co create process creates a healing and positive healing environment for staff, for nurses. And so when nurses are able to work and practice in that positive healing environment, they can themselves embody that environment and provide a healing environment to their patients.
Hello, everyone. Today I'll be discussing how we can promote a healthy work environment using Gene Watson's Caritas process number one, which focuses on practicing loving kindness and equanimity for ourselves and others. This process emphasizes leading with compassion, respect, and balance in all interactions. Loving kindness means genuinely caring for others with empathy and understanding, while equanimity involves staying calm, centered, and non judgmental even during stressful situations. By approaching our coworkers with genuine kindness, we can build mutual respect and trust. A culture of compassion helps reduce tension, improve communications, and prevent conflicts from escalating into incivility or bullying. This creates a safe and supportive environment where colleagues feel valued and appreciated. Practicing equanimity also helps us manage our emotional responses during high pressure moments. When nurses model calmness and patience, it sets the tone for the team and reduces overall stress, ultimately preventing burnout.
Finally, characters process number one enhances psychological safety. When staff feels safe to express concern or ask for help without fear of judgment, it opens the door for honest communication and collaboration. This not only supports team well being, but also leads to safer, higher quality patient care. Incorporating loving kindness and equanimity into our daily practice is a powerful way to foster respect, reduce stress, and create a positive, healthy work environment. Thank you.